So we're going to follow up our annual meeting with a bit of a sponsor spotlight this morning. And I'm very pleased to be joined today by the team from Healthcare Highways and Leaders Life to discuss health plan hot topics. As you guys are very well aware, health plans are increasingly important and just in this environment, incredibly vital when we're talking about the business world as we navigate COVID. Joining us today are Rich Hess from Healthcare Highways and Shannon Young from Leaders Life, the sponsors of today's webinar, and they'll be joined by Brandon Long from McAfee and Taft. Rich, thanks for joining us today. Will you start off by giving us a brief overview about you and introduce your panelists?
Yeah, I'd love to, Brooke. Really excited to be here. Always been a huge fan of the Petroleum Alliance and OIPA before that. The best part about this whole thing is that I get to go before Brandon Long instead of after. So, but yeah, Healthcare Highways, we are a health plan, a unique health plan, as opposed to an insurance company. And what we've done over the last 10, 12 years is compile all of the best piece and parts, if you will, that make up a health plan to bring employers kind of the best in class for what they need to customize their own benefits and ultimately drive down costs. And, you know, whether it might be the adjudication administration of claims, which is certainly a part of it, but really customizing a network of providers, managing your pharmacy spend, et cetera. We think there's 9 or 10 important parts that make up a health plan. And so we bring those to employers, and we actually administer 3 or 4 of the largest employers in Oklahoma currently. But we take when I say unique, we take a different approach. Healthcare has increasingly become reactive, and we feel like the only way to change the course is to be proactive. So we work with members and employees on the front end because we want to create healthier, happier employees, help them navigate the arena that is health insurance for more effective outcomes. And so by doing that on the front end, we then ultimately see a decrease in the employer spend so they can have richer benefits, if they will. But anyway, Healthcare Highways, we're a health plan, tries to keep healthcare local. We think it's more effective that way. And just wanted to be on this webinar with you. So I appreciate it.
Thank you, Rich. You want to introduce Shannon and Brandon here?
Yeah, absolutely. So Shannon Young, lifelong friend of mine, Leaders Life, has been around in Oklahoma for, I don't know, 30 plus years, I would imagine. And so Shannon and I were talking last year about the Petroleum Alliance, and I encouraged him to get to know some of your folks, Natalie, for example, one of my favorites. And so Shannon Young's going to kind of introduce their Leaders Life product or products. I actually don't know what all he's going to talk about, but one of the greatest guys you'll ever meet. And then, of course, Brandon Long really needs no introduction. Besides being an unbelievable attorney, Brandon Long's a great friend of mine who I have the utmost respect for. And so I'm actually looking forward to listening to him talk. Shannon?
Great. Well, I also will mirror that. I appreciate the opportunity to be on this call. As you can tell, this is not my office. I am sitting in a hotel room, so I just kind of wanted to preface that. I had grand plans to make it back to Oklahoma City last night. Did not happen, but no, we at Leaders Life are very excited to be part of the Petroleum Alliance. We you know, we're still learning. Obviously, we're one of the newer sponsors, but are very excited to partner with the Alliance. You know, I think the topics that Brooke had mentioned, he said health plans and hot topics. Golly, has our world changed over the last 25 years? It's brought a lot of sometimes non-health plan benefits into play to to try to control cost. And we at Leaders Life are kind of a big part of that in a lot of employers' benefit packages. Cody, could you possibly put up the ad we put? Yeah, I'm not going to spend a lot of time, but really we just wanted to introduce ourselves. Leaders Life, we're actually 32 years old. We are an Oklahoma life insurance company. We're kind of an oddity in the insurance world because you can't buy life insurance from us. The only way you can secure life insurance is through your employer. We only deal with employers. We do not write any individual coverage, but for that reason, we're able to really create a unique benefit that really has targeted employers a hole they've had for many, many years. It's just gotten bigger and bigger, and that is the employee's ability to have life insurance that does not leave when they retire or when they terminate, and basically provides them a benefit that becomes more of an asset, the older they get. Cody, could you move that down just a little bit, just a tad? Okay. This is the ad that's in the wellhead. I'll ask you to refer back to this if you have any questions. At the end, we're going to provide about an 8-minute video that you're welcome to look into at your leisure, but that is a video that explains kind of what we do. We are brought to an employer, or we are brought in by an employer to provide permanent term to 100 life insurance that doesn't change as the employees get older or they retire. It doesn't have a rate reduction schedule, but the biggest item is that fourth point there that says portability. That there's a lot of bells and whistles on all benefits that are a lot of fun to talk about, but the reality is we are there for one reason, and that's so that employee, when they do leave, when things change, they do not lose their life insurance. So kind of boring, but I've spent 32 years with this. I actually have a pretty unique story. I started with Leaders Life in 1990. I was here for 10 years and left, rebuilt this same product with another carrier, was there for 13 years and came back in 2013. So I'm an oddity in the industry. I've spent 32 years with one particular product line in one market. And a lot of people can view that as either he's extremely lazy or he's found something that works. I prefer to choose the second one. The last thing I'm going to mention to you is on the life insurance. There's generally a very minimal time spent with life insurance by employers. If you go ask an employee, do you have life insurance? They always say, yes, I have it through my employer. And that kind of puts a little bit of a kind of an unstated responsibility on that employer to provide a benefit that is going to be long-term. I don't think that communication has always had. So anyway, we're glad to be here. We appreciate the opportunity to visit with anybody that is curious or has questions about that. Like I said, there will be about an 8-minute video that you're welcome to access that we actually created last year for COVID. Employees need to have a better understanding of how all their benefits work, and it's very difficult. So we put an 8-minute video to explain how their group life works, when it ends, when changes occur, and a solution for them, not only for themselves, but for their family members. So we're happy to be here. We appreciate the opportunity. Look forward to any discussion or conversation. Thank you.
Thanks, Shannon. Brandon, you want to take it away?
Sure. Let me see if I can navigate the hardest part of this. You guys see my slides okay, Shannon?
Yeah, looks good.
Does it look good? Okay.
Yes.
Well, thank you all for joining. I think I have roughly 10 minutes, you guys, or so, and we have kind of a lot to talk about. So I'm going to just dive right in to our topics here. I'll tell you, for most, and for those of you that are familiar with this, forgive me, that most employers' health plan costs are about the second largest expense behind payroll. and it's become increasingly more complicated. Running a health plan, it costs a lot of money, and then there are lots and lots of rules to keep track of. We have a whole host of new regulatory requirements that come into play very soon. And so my hope here is that in the next 10 minutes or so, I'm going to give you maybe some reminders of requirements coming down the pike that we probably all need to be thinking about for 2022. Just last Friday, there was some new guidance issued by the government and the tri-agencies that kind of oversee health plans. I was telling one of my partners this morning that when I saw it come through on Friday night, I thought, oh crap, there's one more thing we have to read and follow. And so I suspect many of you are the same way, which is, if your job is not like mine to just sit around and read this baloney all the time, it's just one additional thing to, after another to kind of keep track of. So here's what we're covering in our kind of hot topics discussion this morning. And again, I'm jumping right in. So starting in 2022, there are new compensation disclosure requirements for health plan brokers and health plan consultants. This is a big deal because, about half of my law practice is designed helping employers manage their retirement plans and retirement assets. And then about half of my practice is help clients manage health and welfare plans, medical plans and such. On the retirement side, we have for a long time now, since I think about 2012, had fee disclosure requirements where the regulations require service providers to disclose to employers all the ways they're getting paid directly and indirectly. So on the retirement side, there is no hidden money. There's no funny money, no back, door payments. On the health and welfare side, it has been the Wild West. And so, and sadly, and I've got lots of friends in the consulting space, a lot of really good friends who are really good, very honest, ethical people. So I'm not saying that consultants as a whole are bad or anything, but the reality is there have definitely been lots of compensation that employers and clients don't even know is happening. And there's not been any requirement by brokers or consultants to disclose that to employers like there will be starting next year. Give you an easy example that I like to give is if, I think I looked and there are about 20 people on this webinar here total. And let's say that I was the consultant for all 20 of you. And let's say and Rich Hess was an employer. And so I went to Rich Hess and I said, this year I want to I think you should move your health plan from XYZ network to ABC network, because I think ABC will be better for you and your employees next year. And Rich says, okay, great, let's do that. So we moved Rich's plan to ABC network. And by the way, I'm purposely not using names because I don't want any of the networks, my friends that are at networks, to think I'm picking on them. But typically we're talking about someone like Healthcare Highways or the BUCAs, Blue Cross, United, Cigna, Aetna, et cetera. Well, me as the consultant for Rich's plan, and again, in my bad example, I'm the consultant for the other 19 of you, I might look at Shannon's plan and say, it's probably better for Shannon to move to ABC network in 2022 as well. But I might be thinking to myself, but I'm moving Rich's plan already, and I get a book of business retention payment on the back end from XYZ network if I retain a certain percentage of my business with them. And so I go to Shannon and I say, hey, Shannon, let's give XYZ network one more year just to kind of see if it gets any better, because it's a big disruptor moving your plan from XYZ to ABC. And the reason I'm doing that is not because necessarily that's in Shannon's best interest. It's because I'm worried about my own compensation. Well, there won't be any of that kind of stuff going on starting next year, because last year's budget act that was passed in December of 2020 imposes new fee disclosure requirements on health plans, health plan brokers and consultants, very similar to the disclosure requirements required on the retirement side that have been in place since 2012. ERISA requires compensation for service providers to be quote unquote reasonable. Yeah, I've been practicing law for a long time now. When I see the word reasonable, I still have no idea what that means. In the context of fees and compensation, though, I can tell you, if you think about how do we determine whether a fee is reasonable, how do I determine if it's reasonable for me to pay $6 for a can of Coca-Cola? That's because I know that I can go to the convenience store and get it for $1, or I can, get it some other place out of a machine for 50 cents or whatever. Again, another dumb example, but I know what's reasonable in terms of price because of my experience and my knowledge. Well, the good thing about these disclosure requirements is they're going to help all of you and me evaluate the compensation paid to our brokers and consultants to make sure that their fees are reasonable going forward. If their fee is not reasonable, it violates ERISA. It's a prohibited transaction. In terms of who's required to, so it's bad. You can't, basically, there have to be disclosures, and the compensation disclosed has to be reasonable. These requirements apply to any broker or consultant that makes or expects to make a total of $1,000 or more. And so that's going to pick up most of our folks that are helping us with our plans. They also have to disclose, in addition to the amount of money that they're receiving, they have to identify whether they're acting as a fiduciary. They have to identify who's paying them, if it's someone other than you or your plan. And so this is a really, I think, a positive thing that really fits with the dialogue, at least in Congress, in terms of the way they've been passing rules, in that there is a big movement for there to be way more transparency all the way around, whether we're talking about provider costs, or we're talking about pharmacy, or we're talking about consultants. The rules are being designed and crafted on the health plan side like never before, so that we all know exactly what we're paying for, and we can kind of go into decisions with our eyes wide open. So these requirements are effective at the end of this year. To the extent you have consultants or brokers helping you with your plans, you need to ask them if they intend to comply, and maybe ask them what kind of challenges this is creating for them for 2022. But I'd keep an eye on this and make sure you get those disclosures, because they are required, i.e. it's not optional. Similar, I mentioned there's this big push for transparency. There are huge, this is like radical disclosure requirements starting in 2022 for health plans. And so really, Jane, for plan years that begin on or after January 1 of 2022, plans have to disclose 3 machine readable files. And machine readable just means a computer can access them and kind of do searches. And so, for example, the McAfee-Taft plan, starting the first plan year beginning on or after January 1 of 2022, which for us would be January of 2022, has to disclose certain information related to our in-network provider rates, certain information related to our historical payments to out-of-network providers, and certain prescription drug information. Now, this slide that I prepared and have here for you was prepared before the guidance issued last Friday. So last Friday's guidance gives us until July 1 of 2022 to get these machine readable files disclosed as it relates to in-network provider rates and out-of-network provider amounts. And it also postpones the enforcement of the prescription drug file. But still, what we need to be doing right now as employers is and service providers, we need to be making sure that we're ready for our plans to disclose these files starting July 1 of 2022. And then starting in 2023 and 2024, well, in 2023, our health plan, again, the McAfee-Taft health plan, picking on myself, we have to disclose 500 designated items and services that we have to provide an online shopping tool so that our employees can get online and kind of do a comparison between, is it better to go to, Johnny Joe doctor or Sally Sue doctor from a pricing standpoint. And then in 2024, instead of it just being 500 certain items in 2023, 2024, we have to have a comprehensive online shopping tool that allows our employees to shop everything. It's really important to know, you guys, that you can't require anyone to have to log in. You can't require like a username and a password. And so what really sucks for a lot of, and that's my legal term, but it sucks for a lot of the BUCAs and the healthcare highways of the world, is that they have historically deemed their rate information to be confidential and proprietary. And that is no longer the case, because we're all going to be required to disclose it. So again, I'm not sitting here working on developing 3 machine readable files for my employees, but my service providers are. And so I would be working with your network and your third-party administrator to kind of get an update on where they are with all of these requirements. They will know what you're talking about if you ask them about it. It's ultimately your responsibility, if you're a fiduciary of a plan, to make sure that these rules are complied with, but practically someone is going to have to doing this for you. And so I would have this conversation with your consultants and maybe your network providers. I think I'm just about out of time. I'm going to cover just a couple more things, you guys. Similarly, there's a No Surprises Act that was just passed at the end of last year as part of the budget deal. It also goes into effect for plan years beginning on or after January of 2022. And these laws comprehensively require lots of changes to the way we handle scenarios where Brandon says, hey, I need a knee surgery. I look at my health plan network and I see, we use Healthcare Highways. I look at the Healthcare Highways network directory and I see that John Joe Smith is in network. And so I go to him for my knee surgery or I go to a hospital system for my knee surgery that's in network. And then I get a huge bill from an anesthesiologist because they used an anesthesiologist that's out of network. And I didn't know that. This law will prohibit that. And there's a lot that goes into this. But it goes into effect here. We're almost done with August. We really have about 4 months until this rule kicks in and all of its requirements. And so again, get with your consultants and your network partner and your third-party administrator, make sure they're kind of on track to help you comply with this. One thing that the No Surprises Act also includes is a requirement that we give employees advanced explanation of benefits and an advanced EOB. The guidance issued last Friday, this is a real challenge for providers and plans. And so the government last Friday afternoon recognized this, and in that guidance they issued last Friday, this advanced EOB requirement was tabled until the future. So this requirement still exists, but it's not going to be enforced in 2022 like it would have been up until last Friday. And maybe the very last thing to cover here is I want to talk to you about state pharmacy laws. And you guys know that, my perspective on this is that I think our pharmacists are just critical to us, our families, our employees, and especially in small town Oklahoma, where we have, great pharmacists who do just amazing. My first job out of high school was working for a small pharmacist. But what has happened is because the pharmacies in small town Oklahoma and our other states too, it's not just here, because they are struggling to compete with the CVS's and Walgreens and Walmarts and such, there have been laws passed and being considered that would impose, basically would require health plans to not incentivize employees to use one pharmacy over another. So we have these various state laws being kicked around and considered that really are trying to do very good things in helping local pharmacists and communities and helping employees have access to care. But what they are also doing is they're imposing requirements on all of you and all of our clients that would prohibit, for example, one of our clients has an on-site pharmacy, their own on-site pharmacy, where their employees can go to their own on-site pharmacy and receive prescription drugs at significantly discounted prices. And it's widely popular among this employer. Well, the law that was proposed in the last session at the state level would have prohibited that employer from incentivizing its own employees to use its own pharmacy. In other words, we would have to make the small town pharmacies from a pricing standpoint, be at the same pricing level. I also know that for some of our clients, when we looked at the statistics, without the state laws, by the way, are targeting pharmacy benefit managers, which none of us have a problem with, but we also aren't, as employers, we're not carrying the flag for them because we struggle sometimes to get good transparency with PBMs. But anyway, the law is targeting these pharmacy benefit managers in favor of small town pharmacists, but the reality is it's it will put handcuffs and restrictions on health plans in ways that will drive up costs. And the last thing on this topic, and then I'll shut up because I think I'm over time, is with some of our clients, when we have compared without the help of our PBM, the average script price for drugs at some of our independent pharmacies compared to the big change, the pricing has been almost double. And so while we all value our independent pharmacists and want them to be in business, and we all need to think about and work together collaboratively with the pharmacists to try to find ways to kind of help them and help our employees, it's important for all of us to kind of keep an eye on these state pharmacy laws, because they're really having a big impact now from a law that was passed in 2019, and some of the laws being kicked around in the last session that I think will be kicked around in next year's session in 2022 would impose fairly significant restrictions on health plans. So I'm sorry I'm over time. I will shut up and then happy to talk about any questions. And I'm going to stop sharing my screen.
Now, Brandon, that was very informative. So thank you very much for that. Rich, do you have any questions that you would like to ask of Brandon and follow up for that? All right, let's talk a little bit about the healthcare highways if you don't. So how is the healthcare highways model different than other insurance companies or health insurance models that are out there? You touched on that a little bit briefly. Do you want to unpack that any?
Yeah, so one of my favorite pieces of what we do, and it's very unique to us. I don't know of any other folks who are doing what we do. I talked about proactive versus reactive. We actually have an entire care coordination team in Oklahoma City made up of nurses, a pharmacist on staff, doctor on staff, et cetera, who, once we receive a group's data, an employer's health insurance claims information, we stratify that data and reach out proactively to members. So I might expect a phone call from one of the nurses saying, "Hey, Mr. Hess, I noticed you haven't had your physical this year, or can I help you schedule this or that service? I noticed you have shoulder surgery coming up. Can we compare and contrast 3 providers for you?" So our nurses, our care coordination team, take a proactive approach to reaching out to members, which ultimately helps those members navigate the health plan and the system. So creating healthier, happier employees, which, when you play it forward, actually reduces the overall cost of the plan to the employer. So, and I have story after story of members who we've helped with prosthesis, cancer treatment, surgeries, et cetera. But that's really what sets us apart, is our care coordination team.
Great. Brandon, you talked a little bit about what sounded to me as if it was care that was basically postponed or diverted from 2020 to 2021 and some of those things. Can you talk just generally about some of the things that you're seeing out there and how that's impacting both the plans and employers?
Yeah, so you guys, it's interesting. I sit in on, not all of my clients, but a lot of them. I sit in on their meetings with their consultants where they're reviewing their spend, kind of how much is the plan, what's the claim volume currently, what's our dollar outflow currently in 2021. And what I am seeing pretty consistently among employers is that 2021 is not a good year from a cost perspective, because what happened, and this is all a little circumstantial, but what we think happened, and I say we, all of the folks that I listen to give these presentations kind of say the same thing. It appears that in 2020 that people, didn't go to the doctor because of COVID. They stayed home, right? We're all sitting at home drinking too much wine with our family. I'm speaking for myself, on the back patio or whatever. And we're not getting out. We go to the grocery store and Lowe's, and then we come home. And so what happened is all those, all of the physicals, all of the surgeries, all of the things that kind of could get kicked down the road, got kicked down the road. And so in 2021, when I've sat in on meetings and reviewing claims data for 2021, we're seeing massive spikes in cost increases this year. And it's not really, it doesn't appear to be because, the rates have gone up in terms of what people are charging. It just is the volume of activity because of the pent up demand. At least that's what it seems. And so one of the things we've been trying to do to try to compare and get a sense of is our spending out of control, or is it really just pent up demand from COVID, is maybe trying to compare 2021 data from 2019 data to try to get some kind of an apples to apples baseline to say, does 2021 look like 2019 in terms of our volume, because when you compare it to 2020, it obviously will be very skewed because of the lack of activity in 2020. I think what is interesting too, though, is I have this pet peeve, by the way, when I sit in on meetings and I listen to my consulting friends give all this data about our claim spend, and well, you've got, you know, a hemophiliac, or you've got, you know, somebody with myeloma, or you've got, you know, 3 people that have breast cancer or whatever, and you get all this data that shows all these cost trends, and I'm kind of sitting there and like, yeah, that's interesting, and man, it really sucks that our costs are going up, and but I'm like, what do we actually do with all this information, right? I mean, we have all this data about how much things are costing, and you're like, well, I just hope we get lucky next year. And so I think what, you know, what some people are doing, like my friend Rich, I think what people are doing is trying to find ways to be more proactive so that we're not just sitting back and hoping next year is better than this year. We're actually reaching out to those people that are ill and not trying to pick on them or make things hard for them, but really making sure that we're frankly helping them get the care they need, because if they get the care they need, that keeps our costs down. And so I think in the future, because of all the transparency and really just the way the market is going, we're going to see a lot more people trying to be a little more proactive and creative than we have been in the past in the health plan space, where it's historically just been, well, your costs are going up 10% this year, and I'm sorry, you know, that's kind of what it has been for a long time.
So it makes a tool like Healthcare Highways is providing even more important, I think, as employers and benefit managers think about how they, especially in this environment for oil and gas companies, look to make certain that we control our costs. So
yeah, and your data, you know, that's a thing, Brooke, that we, if you listen to people that are real thought leaders in this space, getting access to your own data, like in real time. So, and what I mean by that is, if Brandon went to the doctor today and I determined, God forbid, that I had, you know, some serious health condition, that might not, you know, you might not show up on your claim feed for 2 months with, and having real-time access to your data so that immediately a nurse, some sort of care coordinator sees that, hey, Brandon's got something going on, and we need him to know that if he goes to XYZ pharmacy, he can get all of his drugs for that for free, or kind of coordinating, saying, hey, I want to help you navigate through this process. But getting access to data is really a critical part of the discussion when you start talking about this kind of stuff too.
That's right. And being able to adjust on the fly, make changes. I was just working on a group last month, Brandon, that was very frustrated with their increase in cost coming up. The group is fully insured. And so they don't have a lot of control over it. But when I really went through the data I was able to get, they had 17 ER visits. Come to find out, the employees had this very similar copay to go to the ER as to go to their primary care. And the employee, doesn't realize is that's costing the employer, the plan, you know, 4 or 5 times as much as going to their primary care physician. So
that's another example of how important this conversation is. Shannon, let me touch on something that you mentioned. You talked about portability. A lot of us, we've already discussed, get our initial life insurance through our employers. Where do employees get their life insurance outside of their employers typically?
You know, that's a great question that actually has changed, you know, historically. And as you can tell by the color of my hair, I've been around a while, but 25 years ago, it was very simple. Employees got their life insurance through a local agent, or, you know, the old agent sitting at your kitchen table going over that with you, or your property casualty agent. I mean, there were places where you could access that. That has really changed over the last 25 years. You know, we all know everything is bought over the internet now. The problem with life insurance is most employees don't have a good knowledge. You know, what's the right type of insurance? How long should it last? You know, all those factors come into play. And a lot of times when they start that process on the internet, they don't complete it. So they really rely more on their employer. They say, you know what, I don't really understand this, but I'm sure my employer does. So, you know, that's really who they defer to. But it's a great question, and it's changed. yes, it's made it convenient, but it's also caused a loss of knowledge in the type of insurance.
So when you think about life insurance policies and you talk about them as assets, that's something you guys discuss with your clients, et cetera, too, right?
Correct. Yeah, I do. I have done thousands of group meetings. Rich has been with me on a lot of those over the years. And when we finish a meeting, I always show an example to employees, and I always use myself as an example. And I explain to them that I'm 58 years old, and I ask them to look at the rates for a 58-year-old for a certain amount of coverage. And when they go to that, or actually I ask them what my rate is, and they go to my age at 58, and they say, okay, well, here's your number. I said, well, that's a great answer, it's just not correct, because I didn't give you enough information. I bought my coverage when I was 34. The 34-year-old rate is way different than the 58-year-old rate. But the beauty is every year I get older, it becomes more of an asset because I'll always be 34, regardless of what color my hair is. And so the older you get, the more valuable it becomes to you.
Okay, great. Rich, you mentioned a little bit about your previous experience with one of the legacy organizations, OIPA, and your current relationship with Petroleum Alliance of Oklahoma. Can you talk to me a little bit about why you've chosen to work with the oil and gas industry beyond that? Are there things there, factors that you consider when you think about that pool?
Yeah. I've never really thought about it a whole lot. I guess just instinctually, the oil and gas, the folks in the oil and gas industry tend to be risk takers, and so are we. So, you know, we're taking on the old ways of managing healthcare, and most people aren't willing to. It's a pretty large freight train, fast-moving freight train, as I like to call it, of healthcare, and so we're trying to change the direction of that, and we actually will take risk with the employer groups. So we put our money where our mouth is. We know that our care coordination team can affect change, and we know that managing the pharmacy spend and how claims are adjudicated and setting up contracts with providers and facilities, when you combine all those things and analyze the data and make proactive decisions looking into the future of how this is going to affect their spend, then we know we'll decrease their spend. So we're actually willing to take risk with the employer groups on the stop loss coverage.
Okay.
May I ask a question for Brandon?
Yes.
You know, Brandon, I really enjoyed the slide you put up regarding transparency. That's something that I personally, and I think a lot of my associates have talked with over the years, that is all. I mean, it's very difficult to make any decision if you don't know your rules. And I see that as a big positive in the employees being able to become more knowledgeable on how they shop. But I thought it was very interesting because during this call, I got an email from one of our marketing people down in San Antonio. And I'll read it to you. And it says, an agent asked if Leaders Life issues a form 5500 at the end of the year to the group and broker. It shows everyone getting commission. Now, I know this looks set up. It's not. I just got this email, but it made me kind of giggle a little bit because that's really what we're talking about. I guess my question is, how does that new disclosure statement change, or is it different than a 5500 filing?
It is. Yeah, it is different. So your 5500 is the tax return that benefit plans file. Or a lot of benefit plans file. Some plans aren't required to. That disclose all sorts of kind of Campbell soup about the plan, its name, the number of participants, financial information. And, you know, typically there are certain service providers to plans that are required to provide compensation disclosures in connection with that. And that's been the case for a long time. But Shannon, this new disclosure requirement is way more robust. You can't because there are defined terms in terms of what compensation has historically been required to be disclosed in connection with that 5500. And so a lot of, things like indirect compensation rather than direct compensation. Indirect compensation, you know, like my example I gave at the beginning about a bonus payment that's paid on a total book of business payment or something like that. Those kinds of things have not been had to be disclosed in the past, and going forward, there will be kind of none of that. So we've got a lot more robust requirements than we've had in the past with the 5,500 requirements.
Okay. Thank you.
Sure.
So we have a few more minutes here as we wrap up. I'm going to ask Brandon, as for those HR and managers who are paying attention today, are there any other things that you would like to cover just to let people put a pin in it and think about what they need to be considering right now?
Brooke, if I might mention one thing that I think will be interesting to you, that I'm getting a lot of questions about, and it relates to whether you can incentivize employees to get a COVID vaccine.
Yes.
And so there's kind of a Bermuda Triangle of rules related to this. And so I would not, and by the way, I'm not selling you this so you can call me. I've got plenty of things to do. I'm just call your lawyer and have them help you, or your consultant, before you give kind of incentives. But generally, if your employees are going to voluntarily provide their vaccine information, indicating they got a vaccine at Walgreens or whatever, you can offer any incentive you like. And so if you want to incentivize employees to go get a vaccine from a third party, you can give them cash. You can do all sorts of things to incentivize employees to get vaccines from third parties. If you administer the vaccine, or you coordinate with the provider, there are limitations on what the amount of the vaccine can be. And there's more risk, legal risk, and legal things to think about if you're actually administering the vaccine, or maybe you're coordinating with one provider to provide the vaccine. You might be creating a group health plan. You might have some HIPAA non-discrimination things to think about. Be very leery about encouraging employees or trying to incentivize employees to give you information about whether their spouse has been vaccinated. I would say that is a big no-no. So very complicated. You can do it. You can provide incentives to employees to get the vaccine, but you've got to be very careful, especially if you are the person giving the vaccine or the entity giving the vaccine, or maybe you're having nurses come to your office, or maybe you're sending them to one designated site. It creates some restrictions on the amount of the incentive that you can give. So Shannon, I think, or Brooke, I think that might be the last thing I'd like to say there, because that's a pretty hot topic that I get a lot of questions about.
Well, since you've opened up the box, I'm going to ask one other question on that. That is related to employer requirements for vaccination.
Yeah.
And I'm certain you probably got a lot of questions coming from clients on that. What can be required? What cannot be required? Recognizing that this probably is a deeper dive. Do you have any general thoughts on that? What you would like to share with the group this morning?
Yeah, sure. And I lead our ERISA benefits practice, and so one of my labor and employment colleagues could give you way better advice on this. But let me tell you, I think that, my thought is, and what I tell people, you can require people to get a vaccine if you want to. But you have to make accommodations for them, based on religion, based on, the religious considerations or medical background. There has to be some give and take, some discussion about those kinds of topics. But I know some employers are requiring the vaccine. And I think as the news media continues to kind of talk about the Delta variant, I think we will see more and more employers doing that. In this marketplace, maybe not as much as others, because a lot of us, or a lot of companies that I work for and employers, they have a very, they don't like that. They want to encourage employees to get the vaccine through incentives. That's why I get a lot of questions about that, Brooke. But they don't really want to tell people they have to go do that, unless we're talking about someone that works in the healthcare field or in a nursing home or something like that. But I think it's very unusual in this marketplace for an employer like, McAfee Teft, or probably all of you, to say, hey, you have to go get a vaccine.
Or as a condition of employment.
Yeah.
Okay. All right. So we're kind of coming up to the end here. Rich, are there any final comments that you would like to throw out there, or Shannon? I'll let you guys just kind of go around the horn here.
No, I again appreciate being on, and look forward to working with a lot of the members over the next few years. and strategizing to bring, creative, thoughtful ideas to the members of the Petroleum Alliance. You guys do a great job advocating for them. And so the more I can meet, the better to really drive this change and work with some of the brokers and consultants that are already working with the Alliance.
Great. Shannon, anything? We do have one more question regarding third-party vendors that I want Brandon to answer toward the end here. Shannon, you got anything to wrap up on your end?
Sure. No, I'll again just kind of mirror what Rich said. I appreciate the opportunity to be here. We are kind of laying the groundwork for a future event where we're working with Natalie now to create an HR luncheon. I don't know how many people on here are in the HR section or maybe owners, but we would encourage them to come. We're going to really do a kind of an in-depth benefit on life insurance. It's generally something, life insurance is generally not had a lot of time spent. We're all spending too much time trying to figure out how we can afford our health plans. So it's kind of an afterthought, but we're going to do a little deeper dive on some strategies for employers on how to, not only address employees, but also their family members. That's a big part of what we do. And like I said, I would encourage you, Cody's going to provide a QR code that will show you about an 8-minute video. And when we created that, it was more for education for employees. But what we found out is it became a pretty useful tool for the HR people they learned a lot about their own current group life plans by going through this video. So again, it's short. I'm not going to tell you it's going to change your world, but it's good information. And I think you'll be more knowledgeable about employee life insurance after you look at it.
Great.
Thank you again for the invite. We appreciate it.
Appreciate you, Shannon. Brandon, the last question that's come over the chat line is, what about third-party vendors on a well site? Can an operator require third-party vendors to have a vaccine before accessing facilities?
Yeah, I don't see why not. I mean, I think if it's kind of, again, I would trust my labor and employment colleagues more on this topic, but I would say yes. I think that if you want to require employees, or if a vendor is requiring, or if you want to require a vendor to require its employees, I think that's just a matter of contract. And then, frankly, I still think the accommodation issues that I mentioned earlier come into play about religion and medical conditions that you have to be mindful of and think through. Well, what if someone has a legitimate medical reason they can't get it, or what if they have a genuine, religious objection? I think those kinds of considerations need to be factored into any sort of a mandate from anyone.
Okay, great. Well, folks, I think we're going to leave it right there. I do want to make sure that QR code is up, Cody, for those who haven't had a chance yet to shoot it. And let me cover some housekeeping matters. First of all, thank you to all our attendees and participants today for joining, sharing your knowledge and insights, and asking questions. I want to remind attendees that registration is open for our Wildcatters Invitational Golf Tournament coming up on September 30th. Sponsorships are still available. And please mark your calendars for the fall conference scheduled for November 7th and 18th here in Oklahoma City. Our in-person event will feature 2 days of speakers and networking opportunities that culminate with the Oilfield Services fundraising auction, an important part of what we do and a great way to network and make certain you secure those vendor customer bonds. And information can be found at the petroleumalliance.com, or look for our events email each Tuesday, or the Alliance Highlights email every Friday. Guys, thank you again for participating today. Really have enjoyed this and look forward to additional conversations.